I'm Sonia Whitaker. I'm Sheila Patel.
I'm Sunil Abiyala.
And I'm Zoho Zir, and today we're going to be presenting on LASIK. So what is LASIK? LASIK stands for Laser Assisted In Situ Keratomyelitis. And this translates to using a laser underneath a corneal flap, which is in situ, to reshape the cornea, which is keratomyelitis. LASIK is designed to treat refractive errors, improve vision, and reduce or eliminate the need for glasses or contact lenses.
Okay, so before we talk about how LASIK eye surgery works, I'm going to talk about how the human eye works. So in order for us to see things, objects in front of us present light rays, and these light rays enter through the cornea, which is located right here, and that's like the very surface of your eye. Your cornea contains a very amazing power called the refractive power, which basically bends the light rays into certain ways so that we can form a perfect image. So the refractive power of the cornea bends the light through the pupil, which is in the center of the iris, and then it passes through the lens, in which the rays they converge together in order to create a sharp focusing point on the retina, which is your back of the eye. So here we have an image of how we see objects that are close to us and how we see objects that are further away from us. So when we see an object that's near us, basically it looks bigger than objects that are far away from us, because near objects fill our field of vision more, and so it leaves a larger image on our retina in the back of our eye. However, far away objects fill less of our field of vision, and so it leaves a smaller image on our retina, and it creates less information that's sent to our brain. Okay. So here we're going to talk about refraction. So basically the definition of refraction is that it's a change in direction of wave propagation due to its change in transmission medium. So for example, if you look at this picture, you have an incident ray coming from an object or whatever. And as it passes from one medium to another, it gets refracted into a different direction, and this would become the refracted ray. And so this is what basically occurs in our eyes. Our cornea has a refractive power. So as the light rays go into our eyes and hits the cornea is now a new medium from the air that the light was originally traveling through. And so once the light passes through the cornea and the lens, it will then get refracted so that all the bright light rays converge to one point. However, when you talk about nearsightedness or farsightedness, this is a problem in refraction because they're not hitting the point. Well, they are hitting the point, but not at the right place. And with astigmatism, it's not even refracting at all because it's all going in different directions. And the formula typically related to refraction is Snell's law, which is shown here. And so the main reason we have glasses, contact lenses, or we even do LASIK is in order to correct refractive errors in our eye. So since our cornea has the ability to refract rays, when it doesn't work properly, that's called a refractive error. And this occurs because normally in the human eye, the front surface, or your cornea, and your lens inside the eye form a focusing system, and it's primarily responsible for focusing the incoming light rays onto the surface of the retina into one point. However, the power of the cornea and the lens are perfectly matched with the length of the eye in images in focus. However, when a refractive error occurs, this is because the lenses and the refractive power of the cornea don't match up properly. And so as you can see in a normal eye, the rays match at one point. However, if you're farsighted, or also called hyperopia, which means that you can't see objects that are close to you very clearly, that's because light rays end at a point that's away from the actual focal point. If you're nearsighted, or also called myopia, this is because the rays converge too early and not at the correct point once again. And then if you have astigmatism, the rays are all over the place, and they don't even converge at one point. And so to reiterate, hyperopia or farsightedness, the lens focuses behind the retina. Myopia, which is nearsightedness, the lens focuses in front of the retina. And then if you have astigmatism, it's a little bit different. So I have an image right here. In a normal eye, the cornea is thin and rounded. However, if you have an astigmatic eye, the cornea is much thicker and it's more protruded outwards. And so this causes the rays to not come into one point and go all over the place. And that's just simply because the eye is not rounded enough because of this, and that's inborn. And now here's a video that explains what causes blurry vision.
Many of us have blurry vision, at least to some degree, but what causes it? And what can we do to bring our world into better focus? Light enters the eye through the pupil, which works much like the shutter of an automatic camera to help us adjust to brighter or darker conditions. When we need more light, the pupil opens wider. When we need less light, the pupil becomes smaller. Light rays entering the eye also must be bent into a precise point of focus on the retina, found in the inner back of the eye. When this doesn't happen, our vision is blurred. Eyeglasses and contact lenses sharpen focus by bending light and changing the way it enters the eye. But why do we have blurry vision in the first place? Well, when you're farsighted, your eyeball is too short. This means that light rays reach a point of focus beyond the retina. In this case, you see blurry images up close. But when your eyeball is too long, light rays achieve a point of focus before they can even reach the retina. This means you are nearsighted and objects appear blurred in the distance. Many eyes also have an irregularly shaped cornea, which is the clear part of the eye's surface. When this happens, light rays can have several different points of focus. This is called astigmatism, which also causes blurry vision.
So first let's review the structure of the cornea. The cornea is a transparent window that allows objects to be viewed in the form of light rays. It is composed of 5 distinct layers: the epithelium, Bowman's membrane, the stroma, Descemet's membrane, and the endothelium. So LASIK actually, the full operation occurs on the stroma. This is because the stroma has keratocytes, and keratocytes produce collagen. And then collagen is what decides the curvature of the cornea. So LASIK works by reshaping or smoothing out the stroma. What it does is it removes pieces of the collagen in order to either flatten or steepen, depending on the patient, the stroma. And when it does this, the cornea will more accurately focus light on the retina. The laser uses a cool UV light beam to get rid of microscopic amounts of tissue from the cornea, essentially. So people with nearsightedness, the stroma is flattened. People with farsightedness, the cornea is steepened, and then people with astigmatism have the cornea reshaped because their cornea is shaped unevenly. The procedure takes a total of around 15 minutes. So who should get LASIK? People with healthy eyes should get LASIK. And by healthy eyes, I mean people who haven't had eye complications in the past. People with stable vision should get LASIK. Stable vision meaning that their prescription level hasn't changed. Conditions that may disqualify you from LASIK would include dry eyes, because getting LASIK can cause people to get dry eyes, so it would only make the symptoms worse. Keratoconus, and that's a condition that causes the progressive thinning of the cornea. Keratitis, uveitis, and herpes simplex affecting the eye area, cataracts, glaucoma, eye injuries, and lid disorders. All of these would disqualify you from getting LASIK. If you have extreme nearsightedness or farsightedness, LASIK isn't recommended because it can only solve your near or farsightedness up to a certain point. So even if you got it, you would still end up wearing corrective lenses. Or people with fair vision who only have to use glasses sometimes, not all the time. Any age-related eye changes will not be affected by LASIK, and then if you play contact sports, it's simply not recommended because it could disrupt the flow.
So now we'll be describing the steps of the LASIK surgery. So wavelength technology is a new technology which is used to measure the power of the eye. So it evaluates the unique characteristics of the eye objectively. So usually when you go to an optometrist, it's done subjectively, like you have to decide which lens is better, whereas with wavefront technology, it literally measures how the light waves travel through the eye and fall onto your retina. So it takes into account the differences in the cornea rather than just giving an average. So LASIK surgery using wavefront technology is much more accurate than glasses, contact lenses, and basic LASIK, just because it takes into account like the differences in your cornea, and it also, instead of measuring in increments of 0.25 diopters, wavefront measures in increments of 0.01 diopters. So basically, when you go to the optometrist and they tell you to choose between lenses, the increments are at 0.25 diopters, whereas with wavefront technology, they can go down to 0.01 diopter increments. So instead of looking between two lenses, it's like looking between 24 lenses. So in the diagram, you can see that with regular LASIK or glasses or contact lenses, it tries to make the average vision of the eye better, and so it just affects, like it tries to make the entire eye gets the same effect, whereas with wavefront technology, they target each point of the eye and they make sure that there's a specific type of treatment for each irregularity in the cornea.
And now here's a video describing wavefront technology.
The iLASIK Technology Suite, the exclusive combination of Intralace and advanced custom view technologies, delivers truly customized treatments that help you take more of your patients beyond 20/20 vision. An iLASIK procedure begins with a wavefront analysis of your patient's eyes. The WaveScan wavefront system shines a light into the patient's eye. This light is then reflected back from the retina to the WaveScan system, where it is captured and analyzed using proven Hartmann-Shack technology and Fourier analysis. The result of this analysis is a customized wavefront-guided treatment based on the total ocular aberrations identified in your patient's eye. All of this wavefront information is quickly and easily captured at the push of a button. The second step is the creation of the corneal flap with the Intralace FS or IFS femtosecond laser. The physician can customize flap parameters such as depth, diameter, flap shape, and edge angle to meet the unique needs of the patient's eyes. The laser fires thousands of focused laser pulses at a precise depth in an organized, efficient raster pattern to create a resection plane. Pulses are also stacked vertically or at an angle of up to 150 degrees to create the flap edge. After the flap is cut, the physician then manually lifts the flap to expose a smooth, lamellar bed for treatment. Flaps are created in less than 18 seconds, with minimal energy resulting in reduced tissue inflammation, reduced total procedure time, and improved wound healing. In the third step, the patient's wavefront-guided treatment profile is aligned under the laser using iris registration. Often pupils constrict asymmetrically while under the laser, resulting in a pupil centroid shift. Further, the eye can cyclorotate, rotation around the z-axis, when the patient moves from a sitting position to a supine position. Both pupil centroid shift and cyclorotation can result in treatment misalignment and suboptimal results. By engaging iris registration before treatment, these phenomena can both be overcome. The STAR S4IR excimer laser uses variable spot scanning technology to efficiently and coolly remove corneal tissue to accurately correct all lower and higher order aberrations. With the laser ablation complete, the LASIK flap is replaced on the cornea, completing the iLASIK procedure.
So here are some things that patients should do, or things that will happen before the actual surgery takes place. The patient should stop wearing contact lenses before the baseline evaluation, and they should not use cream, makeup, or perfumes before the surgery due to the risk of a possible infection. During the initial eye examination, the doctor will check for inflammation, infections, dry eyes or other eye conditions that might complicate the surgical procedure. And right before the procedure starts, the doctor will measure the cornea, noting shape, contour, thickness, and any irregularities. So the first step in the actual surgical procedure is adding numbing drops to the cornea. The surgeon will pull down the bottom eyelid with a special tool and apply the numbing drops to the cornea. The drops will take about 10 to 15 seconds to take effect, and throughout the entire procedure, the surgeon will be adding rewetting drops to the cornea to aid in the moisture of the cornea and to make the patient feel more comfortable as the procedure continues. The second step in the surgical procedure is removing the corneal flap. The surgeon creates a flap on the cornea by encircling the pupil with a scalpel or a sharp blade. And when the surgeon lifts the flap, the vision of the patient will be completely blurry. But this is normal for this type of procedure. The third step is the reshaping of the cornea with a laser. The surgeon will use an excimer laser to reshape the stroma layer of the cornea. The laser removes cells according to the patient's unique prescription that was found with the wavefront technology before the patient actually came in. And during the procedure, the patient might also hear the clicking of the laser or even smell the odor of the laser actually hitting the stroma layer in the eye. And while all this is happening, the patient will be looking at a red or green light to ensure that the eye is stable for the rest of the procedure. The fourth step is the flap replacement. The flap is placed back onto the underlying cornea, and for this part, their sutures aren't needed, and after everything is done, the patient will place eye patches on each of their eyes. So here we have a video of an actual LASIK surgery being done, and I'll be going over the procedure and the different parts that we went over in our presentation. So by this point, the numbing drops have already been placed, and the lid speculum is about to be added, or separating the eyelids from the actual cornea. And the paper there is to protect the eyelid from the lid speculum. And so there you can actually see the laser that will be used in correcting the stroma. And now the surgeon is marking the eyelid to ensure that the corneal flap will be reapplied. It's just to align the corneal flap. And those are the re-wetting drops that I went over in the presentation as well, to keep the cornea moisturized. So this device is called a suction ring, and what it does is it keeps the cornea intact or in the same position, so the scalpel or another instrument that they're using to cut the corneal flap doesn't cut another part of the eye. And with this suction ring, there's another part that he just applied. It's called a microkeratome. It's just another device to cut the corneal flap of the eye. It's also known as a can opener because of the movement it's making. Bleeding might occur, but it'll go away within the next a few days after the procedure, and that's perfectly fine. And what the surgeon's doing now is trying to soak up the excess blood. The surgeon is now getting ready to remove the corneal flap that he has cut. The surgeon is just getting rid of any excess fluids fluids that are around the cornea so that none of it can get into the actual stroma of the eyeball. So now you can see the corneal flap that has been cut and the surgeon's removing it with the tool. And what you're looking at is the stroma of the eye, and that's what will be reshaped by the laser. Now the surgeon is just wiping away excess fluid so the stroma can be accurately corrected without any complications during the procedure. And so this is the excimer laser that the surgeon uses to correct the eye, and as you can see, the blinking, the flashing of the laser, this is what's correcting, and the cells are actually being removed from the stroma as the laser is being flashed at the stroma. This should only take it should take less than a minute to complete. So now the stroma is completely corrected by the laser, and the surgeon is just cleaning up around the flap so the corneal flap could be reapplied from the hinge. And those are more re-wetting drops to clean away any irregularities or abnormalities in the eye. And the corneal flap has just been placed onto the stroma, and now the surgeon is just doing more cleaning around the area that's been worked on. It's important to moisturize the cornea as much as you can because the flap might not adhere to the rest of the incised part. So the healing process has just begun. As soon as the corneal flap is replaced, it starts to heal. And your eyes may feel irritated after a few hours, but that's perfectly normal. The surgeon is now just making sure that there aren't any air bubbles in between the corneal flap and the stroma. That would cause irregularities or complications in the future. So functional vision should return the night of the surgery or the day after, and follow-up visits are dispersed throughout 1 year at increasingly long intervals. Example, you can go in 1 day and then the next time in a week, and then a month, and then 3 months, and so on and so on. And that's just to track the healing and to measure your prescription that was measured with the wavefront. And most patients reach a 20/20 vision or better 1 year out of the operating room. And so now the eye patches will be placed onto the eyes and the surgical procedure is basically completed.
Thanks for watching!